Welcome, everyone, and thank you for coming. I'm Tim Gardner with Chatham Retirement Partners, and over the next 45 minutes, we'll be discussing some of the things you need to know about healthcare when it comes to planning your retirement. We're going to be covering a lot of information today. If nothing else, I hope you understand the three key points of this presentation. The first key point is that you'll pay a monthly penalty if you do not enroll in Medicare on time. A lot of baby boomers do not know if or when they're supposed to enroll in Medicare. There are very clear rules about when you must sign up. Assessed if you don't sign up in a specified window. The second key point is that if you do not get private insurance to go with Medicare, you'll pay too much in premium and out-of-pocket expenses. The fact that you need private insurance with Medicare surprises many people. Most people think that Medicare covers everything, but no, you need to have private insurance to have prescription drug coverage and coverage for out-of-pocket expenses. I'll show you how that works in a little bit. The third key point is if you do not plan for higher healthcare costs in retirement, you could run out of money and not be able to get the care that you need. People are usually happy to go on to Medicare when they turn 65 because it provides some relief against high health insurance premiums. However, you must be prepared to factor higher future healthcare costs into your retirement budget, and the best time to do that is now. Today's presentation will be broken into three different parts. Part 1 will discuss Medicare. What is it? Who needs to enroll in Medicare and when? And how do you enroll in Medicare? In Part 2, we'll discuss private insurance that goes with Medicare. To understand the public-private partnership that is Medicare, we'll discuss how much Medicare costs, what it covers, what it doesn't, and how private insurance integrates with Medicare. In the third part, we'll discuss how to plan for higher healthcare costs in retirement. There are two reasons why healthcare expenses will be higher in the future. One is inflation. The other is increased need for healthcare services as we age. One expense that needs to be planned for is long-term care. Some of you may have had experience with a parent or a relative needing help with activities of daily living, such as bathing, dressing, or keeping up with housework and preparing meals. Many people are surprised to find out that Medicare does not cover the cost of these services. Okay, let's get started with the educational session by talking about Medicare enrollment. Who pays for healthcare in the United States today? If you're under 65, your health insurance is usually work-based. If you're still working, your employer probably provides health insurance. If you're retired, you might have a retiree plan, or maybe you recently left your job and have extended your employer coverage at your own expense under COBRA. Perhaps you've purchased your own health insurance policy. After 65, Medicare generally pays first. Your health insurance system is set up so that once a person becomes eligible for Medicare at 65, most private insurance becomes secondary to Medicare. When you incur a healthcare expense, the bill is submitted first to Medicare. After Medicare pays what it will, any other insurance you have may pay some or all of what's left. The only exception is employer group plans that cover 20 or more employees. If you're still working and covered by such a plan, or if you're covered as the spouse under such a plan, your employer plan will pay first. This has implications for enrolling, which we'll see in just a moment. Unless you're covered by an employer group plan that covers 20 or more employees, you must enroll in Medicare when you turn 65. If you don't enroll in Medicare on time, the consequences are dire. First, you'll be charged a late enrollment penalty, and the longer you go without enrolling, the higher that penalty is going to be, and that penalty will continue for the rest of your life. The second consequence is that your healthcare expenses may not be covered by insurance. Medicare is the primary payer in most circumstances. If you have other insurance, it will not pay its share until Medicare pays their share. So, if you don't have Medicare, finally, your private insurance options may be limited. If you're in poor health or have a pre-existing condition, your private insurers coordinating with Medicare must take you if you sign up for Medicare during the enrollment period. But if you don't and you go to apply for private insurance later, you may not be able to get that insurance or you may be charged a higher premium. Okay, let's back up and ask, what is Medicare? It is a national health insurance program for people over 65. President Johnson signed it into law in 1965. The Centers for Medicare and Medicaid Services are administered and enrolled by the Social Security Administration. Everyone over 65 is eligible for Medicare. This includes all U.S. citizens and legal residents who have lived in the United States continuously for the last 5 years. Some people under 65 may get Medicare if they receive Social Security disability benefits. Our discussion today will pertain strictly to the first group of people, those over 65. Medicare is divided into 4 parts. Part A covers part of the costs of hospitalizations. Part B covers costs of medical services such as doctor visits, procedures, and diagnostic tests. Medicare pays the bills for Part A and B. Parts C and D are where private insurance comes in. Part C is an alternative way to get Medicare. When you sign up for a Medicare Advantage plan offered by a private insurer and get all your services under Part A and B, and usually prescription drug coverage through the plan. Instead of Medicare paying for your hospital and doctor bills, it pays the insurance company, offering the Medicare Advantage plan a flat payment for each enrollee. Then the plan is responsible for managing and coordinating your care. Part D is prescription drug coverage. It is offered by private insurers who contract with Medicare. Each prescription drug plan is slightly different, so you'll want to shop on Medicare. You'll want to sign up for part drug plans because if you go without drug coverage for very long, you'll face a penalty when you finally do have to enroll. This image shows 2 ways to have Medicare. If you go with original Medicare, you sign up for Parts A and B. Then you decide if you want prescription drug coverage under Part D. The chart shows drug coverage is optional. Still, it can be dangerous to go without drug coverage, so we recommend that everyone plan to have prescription drug coverage starting from the onset of Medicare. In step 3, you decide if you want supplemental coverage. Again, Medicare shows this as optional, but we think it's essential because Medicare leaves too many gaps. The second way to get Medicare is through a Medicare Advantage plan offered by a private insurance company. Many companies offer Medicare Advantage plans, so if you go this route, shopping for plans and finding one that meets your needs is essential. Again, drug coverage is shown as optional, but I recommend choosing a Medicare Advantage plan that offers prescription drug coverage. Choosing how to take Medicare is a big decision. It needs to be individualized, and we can take you through the in-depth today. If you receive Social Security when you turn 65, you will automatically be enrolled in Parts A and B. You may not want Part B if you're working and covered by an employer group plan. In that case, you can decline it. Otherwise, you'll accept Parts A and B, and your coverage will start on the first day of the month that you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, contact the insurance company offering it and sign up for Part C through them. Or, if you're going to stay on the original Medicare and you have a standalone Part D drug plan, you'll need to decide which insurance company's plan you want to go with, and you'll have to enroll proactively. This while you enroll in Parts A and B. What if you do not receive Social Security when you turn 65? More and more people are delaying the start of Social Security to receive higher benefits. In this case, you'll need to enroll in Medicare proactively during a Medicare enrollment period. There are 3 main Medicare enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If an employer group plan covers you because you and your spouse are still working, you have a particular enrollment period, which I'll explain briefly. If you miss either of these enrollment periods, you can sign up for Medicare during the general enrollment period. If you receive Social Security when you turn 65, you'll be automatically enrolled in Parts A and B. You may not want Part B if you're working and covered by an employer group plan. You'll accept Medicare Part A and B coverage, and that will start the first day of the month that you turn 65. Parts C and D are not automatic. If you want a Medicare Advantage plan, contact the insurance company offering it and sign up for Part C through them. If you're going to stay with original Medicare and have a standalone Part D prescription drug plan, you'll need to decide which insurance company's plan you'll want to go with, and you'll have to enroll with them proactively. This while enrolling in Parts A and B before your 65th birthday would be best. What if you don't receive Social Security when you turn 65? With more and more people continuing to work or delaying Social Security to receive a higher benefit, you'll need to enroll in Medicare proactively during a Medicare enrollment period. There are three main enrollment periods. The initial enrollment period applies if you are not covered by a group plan that covers 20 or more employees when you turn 65. If an employer group plan covers you because you or your spouse is still working, you'll have a particular enrollment period, which I'll explain briefly. If you miss either of these enrollment periods, you can sign up for Medicare during the general enrollment period. The initial enrollment period for people who aren't covered by a group plan at 65 starts 3 months before you turn 65 and lasts until 3 months after. Although it lasts 7 months, you should plan to enroll in Medicare during those first 3 months before you turn 65. Your Medicare coverage will start on the first day of the month that you turn 65. If your birthday happens to be on the first day of the month, everything moves up 1 month. For example, if your birthday is June 1st, your initial enrollment period would start February 1st. If you sign up during February, March, and April, your coverage will begin on May 1st. We've been talking a lot about signing up for Medicare as a whole, but sometimes we need to break things into parts. Most people will sign up for everything all at once, but there may be times when you want to sign up for some parts and not for others. If you are still working when you turn 65, check with your benefits administrator to see if you should sign up for Part A. We mentioned earlier that if you are covered by an employer group plan when you turn 65, you may want to sign up for Part A when you first become eligible at 65. The reason is that it may offer better coverage for hospitalization than your employer's plan does. And Part A is usually accessible to you, but check with your benefits administrator if your employer group plan is a high deductible health care plan paired with a health savings account. And if you want to keep contributing to your health savings account, you should not sign up for Part A. The reason is that once you enroll in Medicare, your HSA contributions must stop. If you have an HSA and your employer covers more than 20 employees, you must drop the HSA and sign up for Medicare during the initial enrollment period at 65. If you are not covered by an employer plan when you turn 65, you will want to sign up for Part B during the initial enrollment period, preferably the 3-month period before you turn 65. If you're self-employed, employed by a company with fewer than 20 employees, if you're on COBRA, even if you're receiving retiree health benefits, you'll want to sign up for Part A and B during the initial enrollment period. If you signed up for Parts A and B during your initial enrollment period and think you'll ever want prescription drug coverage, you should enroll in Part D simultaneously. Go more than 63 days without credible prescription drug coverage, and you're in trouble. If you pay a late penalty when you finally sign up for Part D, it's better to get your drug coverage from the onset, even if you aren't currently taking prescription medications. You have two options: enroll in standalone prescription drug plan if you have original Medicare, or get drug coverage through a Medicare Advantage plan. Now we're going to talk about the next enrollment period. This is for people covered by an employer group plan that covers 20 or more employees when they turn 65. You will not be penalized for not enrolling in Medicare at 65, but you will be penalized if you don't sign up during your particular enrollment period. The best time to sign up is before your current coverage ends. This way, you'll have no gaps in coverage. You have a grace period of several months to avoid the late enrollment penalties. For Part B, that grace period starts the month your coverage ends and lasts 8 months. For Part D, it lasts only 63 days. You can avoid the late enrollment penalties by signing up for Medicare during your initial enrollment period. To prevent gaps in coverage, you should sign up before your current coverage ends. What if nobody ever told you about Medicare enrollment periods and you didn't sign up when you were supposed to? You can still sign up, but now you must do it during Medicare's general enrollment period, which runs from January 1st through March 31st of each year. This is the only time you can sign up for Medicare if you are outside your initial or particular enrollment period. Coverage starts 1 month after you enroll. As you can see, this could leave you with some gaps that you want to avoid. So sign up during your general enrollment period, but it may be your only option for some people. The critical thing to know is you just can't sign up for Medicare as soon as you realize you failed to do so. If you're outside the general enrollment period, you must wait until the next one rolls around. Okay, let's quickly review the enrollment periods because this is important. The initial enrollment period for everyone is age 65, not covered by an employer group plan covering 20 or more employees. The best time to sign up is the 3 months before your 65th birthday, and Medicare coverage will start the first of the month that you turn 65. The special enrollment period is for anyone over 65 who is covered as a current worker or spouse of a current worker under an employer group plan that covers 20 or more employees. The best time to enroll in Medicare is before that coverage ends. And then your Medicare coverage will start on the first of the month of enrollment. The general enrollment period is for people who do not attend this presentation and don't know that they need to sign up for Medicare during their initial or special enrollment periods. They can sign up between January 1st and March 31st each year, with coverage starting the month after they enroll. So now how do you sign up for Parts A and B? This, believe it or not, is straightforward. You'll be automatically enrolled in Medicare if you are already receiving Social Security when you turn 65. If not, you can go to ssa.gov, click on Medicare, and then click the Apply for Medicare Benefits button. You can also do it by phone by calling the Social Security Administration at 800-772-1213. Part D isn't quite as straightforward because first, you must decide if you want your prescription drug coverage, whether you want standalone or a Medicare Advantage plan. In either case, you'll be shopping for plans offered by private insurers. Once you decide on the original Medicare versus Medicare Advantage and chosen a specific plan, you can enroll in Part D through your insurance company or Medicare. This brings us to Part 2, Medicare and private insurance. This pie chart shows the breakdown of spending by the average Medicare beneficiary on premiums and services. Almost half of the spending, or $2,294, is for insurance premiums, while $3,166 is spent on services, including long-term care, with a total out-of-pocket spending by the average Medicare beneficiary is a little under $6,000. Now, these figures are from 16. That's the latest information we have available. Focusing on the out-of-pocket costs paid by Medicare beneficiaries falls into two main categories: premiums and out-of-pocket costs. Monthly premiums are paid to Medicare and to private insurance companies offering drug plans, Medigap policies, and Medicare Advantage plans. Out-of-pocket costs include deductibles, a portion of the doctor bill not paid for by Medicare, and services not covered. First, let's look at monthly premiums. Part A is free if you or your spouse have paid into Medicare for over 10 years. This is why most people sign up for Part A when they turn 65, even if they have an employer group plan covering them. Part B is different. It costs $174.70 per month in 2024. Part B premium is adjusted for inflation, so it might be higher next year. High-income beneficiaries will pay more. Part B premium is paid to Medicare. Part D premiums vary depending upon which plan you choose. The Part D premium is paid to the private insurance company whose drug plan you select. This table shows the different income levels and Part D premiums. So if you're single and your income is under $103,000, or if you're married and your income is under $206,000, you'll pay a regular Part B premium of $174.70 monthly. There will be no income-related adjustment. If your income falls into one of these tiers, you'll pay an income-related adjustment on top of that premium. For example, if you're in the second tier, you'll pay an extra $69.90 for Part B and $12.90 for Part D on top of your regular premiums. This will bring your total to $257.50 per month. Keep in mind, these are per person. So if you're a couple, you can double these amounts. This income-related adjustment is based on your tax return from 2 years ago. For example, the adjustment for 2024 would be based on your income reported on your 2020 tax return. Keep in mind that the premiums shown here do not include premiums for drug plans, Medicare supplement plans, Medicare Advantage plans. This is for Part B and Part D only. In addition to premiums, there will be some other out-of-pocket costs under Medicare. If you must be hospitalized, the first $1,632 in hospital costs will come out of your pocket before Medicare starts paying. As we'll see in a minute, some private insurance companies can cover this. Part D deductible is $240 per year. This is waived for some preventative services such as flu shots and certain screenings. Under the standard Medicare design, Part D deductible is $545 per year. However, as we'll see in a minute, Part D coverage is quite complicated. After you've met your deductible, there are some other costs. Medicare doesn't pay your entire medical bill. If your hospital stay exceeds 60 days, you're responsible for $480 per day up to the 90th day and $816 up to the 150th. After that, you'll pay the total cost. Medicare pays the total cost for 20 days of skilled nursing care. After that, you'll pay $2 daily for the first 21 to 100 days. You'll pay the total price if you exceed 100 days of skilled nursing care. As for Part B, your responsibility is 20% of Medicare-approved costs. Doctors who accept Medicare agree to be paid directly by Medicare and will not bill you for more than the Medicare-approved amount. A doctor who doesn't take Medicare may charge more. If they don't charge more than 15% over the approved amount, Medicare will pay 80% of the approved amount, and you'll be responsible for the rest, 20% plus 15% over. Under the standard drug plan design, the beneficiary pays a $545 deductible and 25% of the drug costs after that deductible. There's a small copayment once the out-of-pocket spending has reached $8,000. Drug plans vary widely. Some will pay more, requiring you to spend less. It will be essential to find a plan that covers the drugs that you take. After looking at all these out-of-pocket costs you must pay, you might wonder what Medicare covers. It covers the first 60 days of hospitalization, minus the deductible. It covers 80% of your doctor bills. It covers some preventative services. The best reference for finding out what Medicare covered is the Medicare and You booklet. To get it, you can call 800-663-4227 or go to medicare.gov. The Medicare and You booklet spends over 20 pages talking about what Medicare covers and only one page talking about what it doesn't cover. And I'm not talking about partial payments. I'm talking about the lack of coverage for services you see here. Now, some of these things you can avoid. Cosmetic surgery is optional, for example. If you never go outside the United States, you don't have to worry about that. But some of these things may be necessary, such as dental work, eyeglasses, and hearing aids. These are things you'll have to cover yourself. This is where private insurance comes into play. Private insurance can cover all or part of your deductibles, those hospital costs after 60 days, and the 20% of doctor bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. Depending upon the drug plan you choose, it may cover the deductible and most of the costs of certain drugs during the initial benefit period and the catastrophic coverage period, but it won't cover all drugs. Each plan has a list of drugs called a formulary, and it won't cover much, if anything. Medicare supplement insurance, commonly known as Medigap policies, are issued by private insurance companies and is designed to fill the gaps Medicare doesn't cover. Although they are not affiliated with Medicare, they do have to follow specific state and federal laws designed to protect you. Medigap insurance policies are standardized. They're identified by the letters A through N. Buying a Plan G in California will offer the same benefits as a Plan G in New York. However, the premiums can vary considerably from company to company and from area to area. That's why it's essential for you to carefully evaluate med insurance and not pay too much for it. This table shows the various benefits of different plans. This is in the Medicare and You booklet, so you don't have to memorize it. The main thing to remember is that when you look at a particular plan, it will be the same as every other plan offered by different insurance companies. To ensure you don't overpay for the same policy, Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care. The plan is responsible for providing the care, and you may have to use the network's doctors or hospitals. You'll want a plan that includes prescription drug coverage. You may even get extra benefits like vision care from those plans. However, the benefits and cost sharing for the Medicare Advantage plan differ from those from original Medicare. So again, you'll need to shop carefully and choose a plan that fits your needs. And this is just a reminder once again to shop carefully for private insurance. Policies are standardized, but the premiums can vary considerably. First, choose a plan that offers the coverage you need. Plan G is the most comprehensive plan. Then choose a reputable company offering that policy at the lowest price. Before signing up, check with your provider's billing department to ensure they process the billing from your chosen company. Otherwise, you'll have to pay the bill yourself and then file a claim to get reimbursed by the insurance company. You really don't want to do that. Drug plan benefits vary considerably as well. If you don't take any prescription drugs, you can choose the cheapest plan available and then switch to a more comprehensive plan later. If you take prescription drugs, you'll want to examine each plan's drug list to see what kind of coverage is provided for your medicines. And the same with Medicare Advantage plans. Evaluate each plan's offering and costs and make a clear choice about which private insurance to go with. And now we come to part 3, planning for higher healthcare costs in retirement. Here's a look at healthcare spending by gender and by age group. Women tend to spend more than men on healthcare, and older people spend more than younger people. Many of these higher expenses later in life are for long-term care. Here's what a typical Medicare budget might look like today, considering premiums only. The Part B premium is $174.70. Medigap premium is about $200, and Part D drug premium is about $40, for a total of $414.70 per month. Considering premiums and out-of-pocket costs, the typical healthy Medicare beneficiary might spend nearly $6,000 per year on premiums and non-covered prescription drugs and out-of-pocket expenses like dental, vision, and alternative care. What can cause your healthcare budget to change? 2 things: inflation and the possibility of getting sick. As healthcare costs continue to rise, insurance premiums increase, and the non-covered services you pay for yourself get more expensive. If you get sick, you may need more expensive prescription drugs. There's always the possibility that as you age, you may require non-covered services like major dental work, hearing aids, or even long-term care. How can you plan for rising healthcare costs when you retire on a fixed income? One way is to set aside enough funds to cover your future healthcare costs before you retire. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund their future healthcare costs. They say the average couple will need about $315,000. The Employee Benefits Research Institute did a similar study with slightly different variables, and they came up with about $142,000 for men and $159,000 for women. And that gives us a grand total of $296,000 for couples. That's just the averages. If you live longer than the average life expectancy or have different healthcare needs, you might need more. And remember, these amounts do not include long-term care. How many of you know someone who got old and needed some long-term care? Now, we're not necessarily talking about nursing home care. Long-term care can range from someone coming in the home a few hours a week to help with meal preparation to even skilled nursing care. The critical thing to know is that Medicare and Medigap do not cover long-term care. The most comprehensive Medigap policies only for 100 days of skilled nursing, but they won't pay if you're not sick enough for skilled nursing care. Average period of professional nursing care is just 28 days. When it comes to custodial care for help with activities of daily living, there's no coverage at all. Consider this: 35% of people over the age of 65 have activities limitations. Some need help with instrumental activities of daily living, which include things like shopping and cooking. Others need help with things like bathing or dressing. Here we see the causes of limitations for people over 65. More than half of the population suffers from hypertension, and nearly as many deal with arthritis. We know that these conditions usually get worse as you get older. When you're healthy and active in your 60s, it's hard to imagine not being able to bathe or dress yourself. But it's a fact of life that people need help as they get older. Nearly half of all people over 85 have some sort of difficulty walking, which can limit the things they can do for themselves. For most people, the need for long-term care is gradual. It would be best if you could shop and prepare meals and do housework and manage your own money for a while. A family member or paid housekeeper often provides this level of care. Then you reach a point where you have difficulty with the essential activities of daily living, such as eating, bathing, dressing, going to the bathroom, transferring from chair to bed, and maintaining continence. Nobody likes to think about these things, but we all know people who need custodial care. The third level of care is skilled nursing care. This is care a licensed nurse provides for a medical condition or for rehabilitation. Sometimes this level of care is short term, and if you need it for 100 days or less, Medicare or Medigap will pay for it, depending upon your policy. However, sometimes skilled nursing care is necessary for a more extended period of time, and then the cost can become burdensome. How much does long-term care cost? It varies on the type of care. The Genworth Annual Cost of Care Survey shows the median cost across the United States. Homemaker services cost about $100 per day. Home health aid services cost about $169 per day. Adult daycare is about $78, but it can range anywhere from $30 to $160 per day. The cost of living in an assisted living facility can range anywhere from $3,000 to $7,000 per month, depending upon the location and amenities. The median monthly rate is about $4,500. The most expensive type of care is a nursing home where residents can get skilled nursing care. Private room ranges from $200 to $1,200 a day. The median daily rate is 1 year at this rate, and you're spending about $100,000. None of us want to think about getting old and needing long-term care, but there are some very compelling reasons why we need to. One is to spare your kids and other family members the burden of caring for you. They may not mind doing the shopping or paying some bills, but if you need constant supervision or help with bathing and dressing, that's beyond the call of duty for even the most devoted son or daughter. Another reason to plan for long-term care is to avoid spending down your assets to qualify for Medicaid. This state-run welfare program will pay for your care if you don't have any money. Here's the point: you have to spend down your assets to less than $2,000 to qualify, essentially leaving yourself destitute. People on Medicaid don't have a lot of choices about the kind of care they receive. This is another reason why to plan for long-term care, to direct your care and obtain the type of quality of care that you want. When you're paying for it out of funds you set aside for this purpose, or when you have insurance paying for it, you can decide how you will be cared for, whether in your own home or at an assisted living facility of your choosing. There's a lot more to say about planning for long-term care, but our time is nearly up. So I'll leave you with 3 reminders related to the key points I discussed at the beginning of this presentation. Remember to enroll in Medicare on time, knowing which enrollment period applies to you, whether you need to sign up at 65 or wait until your employer group plan coverage ends, when you need to avoid penalties for coverage gaps. Reminder 2 is to shop carefully for private insurance to go with Medicare. Evaluate your options and choose the drug plan, Medigap policy, or Medicare Advantage plan that offers the coverage you need at the price you can afford. Don't be one who pays too much for private insurance because they don't know any better. Finally, plan now for higher healthcare costs in retirement. We know healthcare expenses will be higher than they are today. When planning your retirement and figuring out how much savings you'll need to make your money last, be sure to factor in the extra amount for healthcare. You'll be happy that you did. This concludes the presentation today. Thank you for your attention. If you like this kind of material, please feel free to like us on YouTube, subscribe to my channel if you want to get continuous feeds, or make a comment because this will help us to figure out what we need to produce so that you can enjoy it and get benefit from it in the future. Thank you.